Covered California has announced the rate increases to health insurance for 2026, but you may not pay a higher monthly premium. I'll explain why. Covered California has announced what they call the weighted average rate change for the health plans that participate in Covered California for 2026. Now, this is weighted because many of the health plans, the insurance companies, they offer HMO plans, PPO plans, they operate in different parts of the state, and all of those plans in different areas may have different rate changes to them, up or down. And what Covered California does is they look at the number of people in those plans and they weight that particular plan a little bit higher because there's more people. It'll affect more people because of the population. And so that's how they determine this weighted average, and it comes out to 10.3% overall. But let me tell you, when you dig into it, some of the health plans have increased their rates way more than that. Looking at the smallest increases to the weighted average, Blue Shield comes in at 9.1%. And of course, Blue Shield has PPO plans and HMO plans. The HMO plans generally are less expensive and they're throughout California. Kaiser Permanente, they operate in Northern California and Southern California, and they're kind of distinct operations. Their overall weighted increase is 7.1%. And then Sharp Health Plan, only in San Diego County with HMO plans, comes in at 8.6%. But Sharp offers two different networks that you can enroll into. They offer a performance and something else. And one of the network plans is more expensive because it has more doctors and hospitals in it. So that kind of skews things. So it's very difficult to know exactly how much a particular rate will be based on these weighted averages. Looking at the plans that have the highest increase, HealthNet, 15% weighted average. Of course, they offer HMO plans and PPO plans, and they operate in Northern California and Southern California. Inland Empire, only HMO plans in Riverside and San Bernardino counties, had a 17.9% increase. And then taking the trophy, Valley Health Plan comes in at number one with the highest rate increase of 21%. And they only offer HMO plans in Santa Clara County. So why such a big jump for Inland and Valley? Pure speculation on my part is that as Medi-Cal has been winding down and people have been transitioning from Medi-Cal over to Covered California, both Inland and Valley were the least expensive silver plans, and so that's where people were generally put into, and so they probably had fairly high enrollment numbers for 2025, and maybe that had something to do with it. But let's look at how this may affect someone in Santa Clara County with Valley Health Plan. And this kind of gets to how the subsidies are calculated and why some people may not realize a big jump in their rates just because their health plan went up quite a bit. So for 2025, Santa Clara County, 40-year-old, full rate, no subsidy. Valley Health Plan was the least expensive at $551. Kaiser was the second lowest cost silver plan at $571. And then you can see all the other carriers were higher. Now, let's apply the weighted average increase, knowing that it may not be exact, but it's going to be pretty close for 2026. That 40-year-old Valley Health Plan goes from $551 to $667 per month. Kaiser, at a 7% increase, goes to $612. And what is significant about this is that Valley Health Plan now becomes the second lowest cost silver plan. And that is really, really important because it is the second lowest cost silver plan, which is the benchmark for the subsidy calculations. And you'll see that the Valley Health Plan at $667 increased 14%. The second lowest cost silver plan cost, full rate for that 40-year-old, increased 14%, which means potentially the subsidies for everyone in Santa Clara County will increase by 14%. Now, this next section is heavy on numbers and calculations, but it gets to how the subsidies are calculated. This is what Covered California does when you apply. These numbers come from the IRS, specifically the instructions for Form 8962, which is the Premium Tax Credit Reconciliation Form. So let's take that 40-year-old in Santa Clara County, $50,000 income, and Kaiser for 2025 is the second lowest cost silver plan with an annual amount of $6,860, so 571 times 12. Now that $50,000 income translates into 343% of the federal poverty level. Go to another table, and the applicable figure from the IRS forms is 0.0708. We know that as the consumer responsibility percentage of the Affordable Care Act, or 7.08%. That means this individual with this income, that percentage of the federal poverty level, should pay no more than 7.08% of their household income for the second lowest cost silver plan. So we take $50,000 times the 7%, we come out with $3,540. That's the consumer responsibility. Then we take that second lowest cost silver plan annual amount of $6,860 for Kaiser minus the consumer responsibility, and we come up with a premium tax credit of $3,320. Divide that by 12, and the monthly subsidy is $276.72. That's what this individual would receive in 2025. Now, let's go to 2026 and apply that weighted average increase to the rates. And that's when Valley Health Plan becomes the second lowest cost silver plan, $667 per month, an annual second lowest cost premium amount of $8,005. Same income, same consumer responsibility of 7%. So we take the second lowest cost silver plan annual premium of $8,005 minus the $3,540 for the consumer responsibility, and the premium tax credit goes up to $4,465. Divide that by 12, monthly subsidy, $372. That's an increase of 26% over 2025. And it doesn't make a difference whether you enrolled in Valley Health Plan or Kaiser or Blue Shield PPO or whatever was offered to you through Covered California. The subsidy would go up 26%. So your monthly premium may go down because the second lowest cost silver plan, Valley Health Plan, went up so much, 21%. And if your health plan only went up 7%, you're the beneficiary. And of course, you get to apply that to any metal tier, bronze, silver, gold, platinum. Okay, so the big caveat to all of this is we do not know if the Biden Inflation Reduction Act enhanced subsidies that we are working with in 2025 will continue in 2026. We do not know if the Republican Congress will renew the enhanced subsidies. Cover California has been messaging people, letting them know, hey, these are good subsidies, a little bit higher, may be going away. So what does this look like if we revert back to 2020 and the original Affordable Care Act subsidy curve, as we call it? So I ran some numbers on that. So assuming that Valley Health Plan is still going up 21%, second lowest cost silver plan for that 40-year-old is still $8,005. Income still the same at $50,000, still 343% of the federal poverty level, and that comes out to an applicable figure on that IRS form of 9.78%. So that is an increase, consumer responsibility, from 7% to almost 9.8%. So we take the consumer responsibility percentage of 9.7% times $50,000 income. Consumer responsibility is now $4,890 for the second lowest cost silver plan. We take that consumer responsibility minus the annual premium for the Valley Health Plan, second lowest cost silver plan, and we come out with a premium tax credit of $3,115, lower. Divide that by 12, and the monthly subsidy for this individual would be $259.61. That is a 7% decrease from 2025. So if we go to the old subsidy curve, everyone's subsidies will decrease and people will be paying more. Absolutely no questions about it. That represents a $112 difference. So if we have, the Biden Inflation Reduction Act in there, and we subtract the lower $259 from it, that's $112, and that people would not be getting. So that's almost a guaranteed, for this particular situation, 40-year-old, $50,000, guaranteed $112 increase to the monthly premiums. So we do not know what the Republican Congress is going to do. Hopefully they will hear the voices of Americans saying, keep the subsidy curve in place, because it will be a huge inflation factor for people in 2026 if they do not renew the Inflation Reduction Act subsidy curve from 2021. Well, if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for insuremekevin.com, I'm Kevin Knaus.